AAPCHO, the Association of Asian Pacific Community Health Organizations. I'd like to thank you all for joining us today. We are very excited to present today's session about the Just Be Storytelling Project and to provide you all with information about participating in our next digital storytelling workshop. My name is Rhea Racho. I'm the Program and Policy Coordinator for the Hepatitis B Foundation, and I manage the Just Be Storytelling Project. Before getting started, I'm just going to review a couple of housekeeping items and let you know how you can participate in the webinar today. First, if you are experiencing any issues with your computer audio, there is a call-in option that's noted on the screen. You can also find this call-in number on the GoToWebinar control panel under the heading Audio. Please note that all attendees are in listen-only mode and will be muted throughout the presentation. Second, just note that at any time during the presentation, you are welcome to submit questions by typing them into the question box in the GoToWebinar control panel. We'll be reviewing these as they come in, and we'll have time for Q&A after the presentation. Lastly, please note that this webinar is being recorded. You will receive an email with a link to view and share the recording within the next few days. Okay, and now I'd like to invite today's other two speakers, Amy and William, to introduce themselves. Amy.
Hi, everyone. Thanks so much, Rhea, and thanks everyone for joining us today. So I'm really happy to be back again talking about this great project. I've been working with StoryCenter. We were formerly the Center for Digital Storytelling, but we changed our name a few years ago. I've been working with StoryCenter for a little over 15 years now, and I lead much of our public health work. And prior to my involvement with StoryCenter, I worked in public health primarily on adolescent and women's health issues for about 10 years.
Yeah, hi everyone. Yes, and my name is William Amite. I am one of the storytellers. I did participate in the workshop, and I will be telling my experience, and you'll probably see my video soon.
Yes, great, thank you. So we'll just go over the agenda now for today's session.
All right, so what we're planning on covering today is just a bit of overview about the Just Be project, and then we will talk a little bit in more detail about what digital storytelling actually is as a participatory storytelling and media production methodology. Then we will look specifically at the kinds of stories that the Hepatitis B Foundation and the various partners on the project are hoping will be told in this phase of the project. And then we'll talk a little bit about how storytellers and how involved organizations will benefit from getting involved with the Just Be project. And then we'll go over specifically how your organization can help. But since we'll be talking quite a bit during the webinar, we wanted to begin by sharing one of the Just Be stories. As William just said, in this case, we're going to share his story, just to give some context to the presentation. So if everyone can please click on the link in the presentation. I'm not sure if people are supposed to click on it, Rhea, or if you're supposed to click on it. But anyway, we're going to take a few minutes to watch the story. Rhea will bring it up, and I think she just also copied and pasted it into the chat box in case people want to access it there. It's going to come up on a YouTube as a YouTube URL. So when you're finished watching it, please feel free to comment with your immediate reactions in the chat box. And then that way we'll know when we can continue with the webinar. So let's go ahead and watch William's story.
And in addition to it being in the chat box there, it is also in the slides that we sent out about an hour ago. So you can click on it there.
was 35, newly married, and looking forward to the birth of our first child. I was excited and ready to be the world's #1 dad. As a finance person, I wanted to get some planning in gear. A will, a rainy day fund, life insurance. I was going to check these off by the time the baby came. The insurance application included a blood test. One afternoon, I got a call from the insurance company. The test results were in. The man asked, "Do you know when you contracted hepatitis B?" I was floored. I had no idea what he was really talking about. All I knew about hepatitis was that it was supposed to be something bad. That night, I told my wife. She was as surprised as I was. The next day, I locked myself in my office and spent hours online. Roving through the search engines was like walking through a thick forest. Some articles roared at me like monsters, telling me I was doomed and would be 6 feet under by age 45. Others told me I'd be okay and could have a normal and full life. As I read on and on, I could not help wondering, what did I do to get this? Did it happen when I came here to the US? Or was it way back in Ghana, where I lived for a couple of years? Or in Tanzania, where I grew up? The next several months were a journey through fear, understanding, and reassurance. After visits to a gastroenterologist and a battery of tests, it was clear that I was going to survive. The doctor said that the virus was not replicating and was not currently causing any harm. He told me, "It's good that you found out, because with minor lifestyle changes, you will be okay. Stop drinking? Check. More veggies? Check. More cardio classes? Check. Bring it on." I understand now that, like all of us with this virus, I didn't do anything to get hepatitis B. Knowing exactly where it came from isn't so important. What matters is what I can do to take care of myself so that I can still be the world's #1 dad.
Okay, I think everyone has had a chance now to view the video. Hopefully you didn't have any issues, but we can send the link out again and definitely share the other video, a link to the rest of the videos if you're interested in watching more. We'll go ahead and start back in and go over, give an overview of the Just Be project. I'll have Amy start off by giving some background and rationale for using personal storytelling.
Okay, thanks, Rhea. I hope everyone enjoyed this story. So I wanted to just go over a few of the kind of key points around why personal storytelling can be so powerful for public health education and promotion. So the first piece is has to do with emotional connection. And so just as everyone tells and listens to stories in their daily lives as a way of communicating and learning about themselves and each other, all people are also capable of experiencing the same basic human feelings. And so when a story addresses themes that are fraught with emotion, the likely emotional response of viewers can make them feel connected to the storyteller and to the story and better able to make meaning from it. And then the second piece has to do with intimacy. So in our work at StoryCenter, we've seen over and over that stories told in first person can really help create a sense of intimacy that engages viewers. So when storytellers work with dialogue or descriptions of what they've gone through, these kinds of elements can touch people's hearts in a way that more third-person reporting or lots of facts and figures about a health issue just can't. And then the next piece has to do with the element of honesty. So the quality of honesty in a story can play a big role in making the story compelling. And one element we've found can be really helpful to that is whether the storyteller is willing to make her or himself vulnerable in terms of the content of the story. And by contrast, when stories are exploitive or overly graphic in how they represent people, when they sensationalize topics, or when they're just a little too slick and polished, those things tend to kind of detract from the sense of honesty. And then the last thing is that working with personal stories allows some subtlety in terms of information that's conveyed. So it really refutes the notion that a media piece has to convey a singular message or set of messages. And what we've seen is, because people are all over the world really are barraged with media messages all day long, both the more subtle kinds of messages of advertising and the more overt messaging in public service announcements. The beauty of a well-told story lies in its subtlety. So it might include important information, but it also shows real-life experiences and invites reflection instead of sounding kind of demanding or preachy or bossy. And in fact, when specific understandings or actions are hoped for, as a result of watching a story, those meanings or actions can really be encouraged in discussions, through training activities, in supplemental information shared alongside the story. And we'll see that with the Just Be project that the information about what people need to learn or do doesn't have to necessarily be part of the art of the story itself. So that's just a little bit of kind of our rationale for working with personal stories with this project. And now Rhea is going to talk about project goals and activities.
Thanks, Amy. So just overall, through our collaboration with StoryCenter on this project, we wanted to make the voices of real everyday people who are living with or have been affected by hepatitis B. We wanted to engage these people and use their stories as a key ingredient of our prevention and advocacy efforts. Overall, our project goals are to increase awareness about hepatitis B, to help decrease stigma and discrimination associated with the disease, to promote testing, vaccination, and linkage to care, and to advocate for individuals affected by hepatitis B, and also for communities that are at high risk of Hep B. And we've learned that through this first year of the project that engaging community members in sharing their personal stories and speaking out about the obstacles to hepatitis B screening, prevention, and care is really essential to achieving those goals. The project activities for 2018 and our timeline is very similar to what we did this past year. So right now we're in the planning and recruitment phase. We'll be accepting applications for our next workshop through December 1st, and we'll talk about that process a little later. Then the digital storytelling workshop will take place in January 2018, January 19th through 21st, 2018 in Berkeley, California, where StoryCenter is headquartered. Following the workshop, from about February to March, the videos that were created will undergo some final editing, and at the same time we'll be developing helpful resources and materials to accompany the videos. Then in April, we'll be providing some follow-up training online to prepare the participants the storytellers for the upcoming rollout of their videos. And then throughout May, which is Hepatitis Awareness Month, and beyond that, we'll be promoting the new videos as part of our overall Just Be Storytelling campaign. So it'll become part of our current story bank, which has 18 stories right now. And the dissemination plan for the new videos will include, we'll have a calendar for featuring each story, a different story each month, so that each storyteller gets 1 month dedicated to promoting just their video on our website, on our blog, and our newsletters, and really highlighting and pulling out key themes from each video. We'll be promoting the stories on social media, pitching them to national and local media, screening them at national and local community screening events, and utilizing them in our advocacy initiatives. So just like this past year, we're going to find opportunities to share the videos and invite storytellers who've participated in the workshops to attend events in person where they can share their story and really add to our initiatives whenever we are meeting with members of Congress or hosting informational briefings. And so that way we can leverage the power of bringing in these personal stories to make the case for increased funding for hepatitis B research and programs. And then beyond this overall timeline, we are committed to supporting our storytellers after the workshop and after we've introduced their videos. So once someone has become one of our storytellers, we do continue to work with them and try to provide as much ongoing support, training and resources, and additional speaking opportunities that we can. So that's the overview of the project, and now I'm going to turn it back over to Amy to discuss digital storytelling in more detail.
All right, thank you. So just to give a little bit of background about StoryCenter, we're a nonprofit. We've been around for more than 20 years now, and as far as we know, our founding director, Joe Lambert, and his colleagues back in the early 1990s coined the term digital storytelling. And as people are probably aware, this term is currently used to refer to quite a wide variety of media production methods or different approaches to making media. For our purposes at StoryCenter, digital storytelling is a workshop process that brings together small groups of people over the course of several days to verbally share stories from their own life experience, to work with our facilitators to develop these stories as scripts and make audio recordings of them, to select and produce images and video clips to use in illustrating their stories, and then to learn through simple computer tutorials how to edit these materials into short videos like the one that we all just watched. In terms of the focus on first-person voice, the method focuses on personal stories for the reasons that I had already gone over in terms of just the power of first-person voice. Digital storytelling, as I said, brings groups of people together in a workshop. There's something much more powerful about supporting people in sharing stories as a group rather than working with them one-on-one. So in a group process, they can really connect with each other, build relationships, gain insight about their own experiences, and then also make connections with project facilitators and partners in terms of then becoming engaged in additional outreach and education work. And then finally, the process, as I said, is participatory. So it's a form of participatory media, which means it was born out of kind of an impulse to democratize cultural and artistic practice, basically to displace the act of media production from a more professionalized realm. into a truly community-based realm, so that everyday people who don't necessarily have experience with writing or stories or producing videos can share and witness stories. So rather than sending video production experts into a community to gather interviews and video footage and then take that material away from the community and make the decisions about how the production is finalized, we put the tools and skills in the hands of those who are sharing their stories. So that's digital storytelling. We've been doing public health focused work for more than 15 years now. Our methods are really consistent with a popular education approach to supporting people and kind of connecting the dots between their own personal experiences of challenge with health issues to the larger kind of systems and structures that contribute to their to those challenges. So the bigger social context. And our methods also fit really well with community-based participatory research, community-engaged research, as well as with the social ecological model for public health, which really ranges the impacts of public health activities along a continuum of impact, from individual education to community mobilization to policy advocacy and change, and so on. So that's digital storytelling.
Okay, great, thank you. So StoryCenter has done a lot of experience in this field and has been able to produce a very wide range of different kinds of stories around different health and social justice issues. So we're lucky to be working with them. But for this particular project, we're focusing on people who are living with or affected by hepatitis B. And the kinds of stories we're looking for, we have examples and suggestions, but it's our goal to represent the diversity of backgrounds and perspectives and experiences of people who've been impacted by hepatitis B. This is true if you look at our current group of storytellers. We have people from all over the country, storytellers who are patients or family members. We have a liver transplant survivor, someone who is living with hepatitis B and HIV. We have stories of adoptive parents of children living with hepatitis B. And then we've got a broad range of ages as well, from the youngest who's 19 years old to one of our storytellers who's 75. And then specifically some of the stories, some of the topics that we're looking at could include, if you want to share a story about your experience living with hepatitis B. So any successes or challenges or experiences having to face discrimination or stigma. We're looking for any family-oriented stories too. So again, like we've got adoption stories, or we're looking for stories about preventing mother-to-child transmission or caring for a family member who's living with hepatitis B. Stories about HBV-related liver cancer or HBV-related treatment or vaccine success. We also have heard from people who can talk about the impact of hepatitis B across generations. People who have known all their lives or found out in their adulthood that they have a family history of hepatitis B, and what they did from there, and how they worked to increase the discussion and dialogue among their family even, and not just among community members. So these are just some examples. At the workshops, we work with people to distill certain topics from their overall story. So you don't have to come necessarily with a specific story in mind, but we like to hear about your experience first, and then try to narrow in on a story that can be told in the 3 to 4 minutes that we have in this video format. And one other thing that I wanted to note, we do get we hear from people from all over the country, and we also hear from international storytellers or people who are living outside of the U.S. And we definitely welcome these stories and for you guys to contact us. But at this time, the January 2018 workshop is open only to individuals who do live in the United States. We would like to stay in touch with anybody who is interested in sharing their story, but who lives outside of the U.S. So you've got my contact information from the email that I sent, and I'll share that at the end of the presentation as well. And anybody who's interested is welcome to contact me to discuss other ways that we can try to help you share your Hep B story. And definitely we will keep in touch with you about potential opportunities in the future to be a part of the Just Be campaign. The next slide, Amy will go over some of the benefits for participating in the workshop.
All right. So I think clearly there are a number of benefits for storytellers as well as for involved community partners of participating in digital storytelling. So the points that Rhea is bringing up, and I think you can just bring them all up, Rhea. They represent just a few of the specific benefits that we're highlighting for the Just Be project. Rather than framing the project as focused only on the digital storytelling workshop process that we just described, we're really offering the storytellers the opportunity to drive the decision making around how and where and why their stories will be shared locally and nationally to counter Hep B stigma, promote screening, prevention, and advocate for care and treatment. And so, I'm not going to, rather than reading these bullet points, since you can see them, I'm actually going to go ahead and just turn it over to William so he can share a bit about his experience of making a story and then also his experience of being involved in the story distribution as part of the Just Be campaign.
Okay, thanks, Amy. And hi, everyone. Well, so I participated, as you've heard, in the digital storytelling, and it was a great experience, to put it simply. Now, to answer the question why I chose to do this, realistically, I didn't know about this the very first time. My wife brought this up to my attention, and after listening a little bit what this entailed, I said, this sounds great, and sounded like there was a good purpose behind it. So, got on a plane and went to California. Now, getting there, my first experience, my first feeling or experience was seeing everyone, and I wasn't sure what this was all about. Said hi to everyone. We I was hesitant in the beginning because it's storytelling, but what kind of story? How is this story going to be told? What am I supposed to say? I had a lot of questions about it, but going through the whole process, I thought about how can I compare this, and I thought, this is you can compare this to like skydiving, and I'll explain that. The very first time someone tells you, hey, let's go skydiving, you look at them like, what, skydiving? Now, some folks will say yes, some will say maybe, and some will say absolutely not. And because, of course, we all have certain thoughts in our minds as to why we should, embark on this experience or this journey. In my case, I was somewhere in the middle. I was just trying to get more information about it. And there are three words I'll say about this to summarize my experience in the storytelling. these were what I say, thrilling, fun, and satisfying, really. And I'll explain the thrilling part of this. So when we like skydiving, you get there, the moment you're in the experience, you kind of don't know what's going to happen at the end of it, right? You're just in the moment. And having Amy there, as the instructor for your skydiving, so to speak, was great, because even though I wasn't sure in the beginning, I think, like Amy said earlier on, it's about honesty and just, telling your story in its raw form. I told my story. I wasn't sure what was going to come out of this. I just said it, blurted it out pretty much. And at the end of it, everyone asked me questions. I answered those questions. We kind of fluffed out my story. So I just said it, and everyone asked me questions. I spoke about it, and then, a story came out of that. And, as I say, every person's story is like a strand of a fabric. It's unique, it's raw, it's honest, and it has its own message, towards that larger message, which I think has been explained by Amy and Rhea. Part of the whole idea of this whole storytelling is to help remove stigma. Now, I had that in the very beginning when I found out about hepatitis B. I was very scared. I had no idea what it was, other than something bad, like you heard in my video. It also helps spread awareness, as as Rhea said. It encourages participation. And that first part of the thrilling part, I'll go back again. The thrilling part for me was, was just the experience in general. I had no idea. I was just kind of, going through the moment. And then the second part was, after I told my story, I was able to kind of, have fun creating the story. And as Amy's there, and Rhea and the other folks who are assisting, and also the other participants who also helped me kind of, put my story into a form that was easy for people to see and hear or understand. But it was the story. My story never changed. It was the same story from the beginning. It's just that I was able to put it together in a way that it made sense, and it relayed my very specific message that I eventually found out what it was. I didn't know in the beginning even what I was trying to say. But the workshop really does help you put it all together. Now, the third part of this experience, which is, I said, gratifying, that's at the end of it. Now, at the end of it, it was like exhaling. There was something great about having told this story. It's almost like getting something off your chest. At least that's how it felt to me. And I know we all have different stories, and our stories vary in different degrees. For me, it was personal. Some of you, it'll be a relative or a friend. So they'll come in different ways. But I think the end experience of that is that of just feeling good about what you just did, and also feeling good that you've created a story that will help others, in one way or another, and allow people to relate, and it continues giving, over and over after you're done. And for those of you who are thinking about coming, I think, as Amy was saying, it's really just be yourself. Really let your story flow. Just let it come out unencumbered, and there's no need to think how to say it, or how to polish it, because the best story, the most effective ones, are the ones where it's raw, and you let it come out without even thinking, but just how you remembered it, how you felt, in its most original form. Now, the last part, what it's been like to participate in ongoing Just Be campaigns. To me, it has been really, really great, and being able to share my story, whether personally or just through my videos. I think that has been something I would not have been able to imagine had I not gone through this workshop. And I think it kind of gives you a purpose, at the end of it, and after that, of something that you feel you're part of a larger story, right? Larger cause, which, as we know, in this case, it's the removal of stigma, spreading awareness, encouraging people to participate. Then hopefully through that there'll be a cure, finally. So if you guys have any questions for me, you can submit those through Rhea, or and she'll be able to get in touch with me. Or if you have any questions right now, please feel free to ask. Thanks.
Thank you so much, William. Yes, and if anybody has questions at this time, you can type them in the chat box, and you can also follow up with us after the webinar if you'd like. But I really appreciate that William was able to come on and talk about his experience, because I know we've heard from other participants too who've had the same reaction, where maybe at first they were hesitant, didn't know why they should participate and why they should allow their personal story to be shared so widely with the public. But I think the workshop itself becomes a bonding experience among people who can really relate to each other and encourage each other. And then, to see your stories become part of the larger campaign, and, depending on your comfort level and your time or your availability, you can continue to be as involved as you would like with ongoing awareness activities, speaking opportunities like this, where just join a webinar or maybe attend in-person activities. So we have been really glad that we have had the opportunity to work with William. But in addition to the benefits for the people who participate in the workshop, I just wanted to talk a little bit about our partner organizations who may be on the webinar right now. Last year, we had a lot of support from Hep B United partners and other organizations who helped us identify potential storytellers through their networks, and we're looking for that same support this year. And like I said, beyond the benefits for storytellers, there are definitely benefits for organizations who get involved, whether it is helping to recruit or helping to share the stories once they're created. So, this project does provide an opportunity for us and our partner organizations to strengthen our relationships and to identify other local partners. It's also a way to bring more visibility to all of the organizations who are involved. And particularly, I think those organizations who helped us find storytellers, they then have somebody in their community who, they know has gone through the workshop and has gone through some follow-up training to become spokespeople and to speak at events and at community screenings. And so it becomes another relationship. So we sustain the relationship with our national partners, but then also we try to encourage local events with our where our storytellers live. We also, even if you're not involved in recruiting or implementing executing the workshop, we will still be sharing resources like a discussion guide and social media guides or templates to help us share the stories online. So that's one of the easiest ways to really help sustain the storytelling campaign, is just resharing our videos and helping to spread the word about the campaign, because the more that we've gotten exposure sharing these 18 videos that we have so far, the more we hear from people who are willing to speak up about their stories as well. Whereas maybe before they were reluctant or hesitant, but seeing other people speak out with similar stories goes a long way in helping us to build the momentum behind this campaign and make a difference in how many people are advocating for hepatitis B programs and funding. So how can partner organizations help? I think I turn this over to Amy now.
All right, so what can those of you on the webinar do to get involved? So really at this stage, the most important thing that you can do is help us recruit and confirm workshop participants who are keen and ready and able to share their stories publicly and work with the project as spokespeople. So to do this, you can share the relevant information and materials with potential participants via email. You can make phone calls to individuals you know who you think might respond better to a verbal conversation. And you can support people in completing the participant information form, where there's a link to that on the slide. And there's also links to that in the materials that Rhea sent out before the webinar. And then it looks like Rhea also just pasted that information into the chat box. So those are kind of the primary ways that people can help us with this next phase. And then of course there will be lots of opportunities to help support the public sharing and distribution of stories. So if you're interested in that piece, please also get in touch with Rhea.
Thank you. And we also have a flyer that we'll share after the webinar, along with the recording and some other materials that would be useful for partner organizations and disinterested individuals. We'll include that in the follow-up email. And then yes, the application, the link to the participant information form is there in the chat box and in the materials. And I think I mentioned before, but it's also in the info packet, that we'll be accepting these forms until December 1st. And then, depending on the interest, we'll take some time to review the forms and contact people about the January 2018 workshop. That brings us to the end of our presentation. So we want to open it up now for Q&A. If you have questions that you haven't had a chance to type yet into the chat box, please feel free to do so now. And I'm just going to look through to see if we've received any yet. Okay. Well, one, I see Kenneth added a comment/question. Thank you for that. And he says, I'm just wondering how possible it could be for an African patient-driven organization to carry on with this project. I think there are definitely opportunities to brainstorm and to connect you with other organizations or resources to create videos or do storytelling workshops locally. And in fact, I think Amy could probably answer that even better, but you could connect with either Amy or I to come up with ideas, but I'll let Amy if you have anything to add, because I know you do international work as well.
Yeah, sure. I mean, I think there are informational webinars that you can take on public health digital storytelling through our center. And then the kind of longer term goal with the Just Be project is, in fact, to be able to take it to the international level and be able to do some workshops either in East Africa or Sub-Saharan Africa. So, you know, when and if that all unfolds, it would be great to reconnect and figure out how we can work with you. Certainly in the meantime, our organization does quite a bit of international work. So if you want to hear more about that and, you know, kind of learn some of the resource requirements and technical requirements, please feel free to email me. But I've done actually quite a bit of work in about 10 different countries in Africa and in other parts of the world. So it'd be great to hear from you.
I'm going to read another question we have, that English is not my patient's first language. Would that be okay for them to apply? One thing that I forgot to mention earlier is that while we do have all of our stories available in English, we also, for people who first language is something other than English, we do provide an opportunity for some participants to record their story in their first language. So in the application form, you will find that we do ask questions about what the storyteller's language is and what their comfort level in English is as well. Because we're not sure if we'd be able to provide any full English language translation or interpretation during the workshop itself. So patients will need to be fairly comfortable participating in the workshop fully in English, but then we can hopefully find a way, if people are applying who need some support, we will try to find ways to offer that. And with the writing out of the scripts, we will have staff there on hand to write out the transcript in English and help if anybody feels uncomfortable with just structure or grammar or anything. Like, we can support them in that. And then, like I said, we are trying to offer opportunities for people who are more comfortable in another language to also to translate and record their stories in that language. Sorry, I hope that's helpful. If you guys have any follow-up questions around language, please feel free to email me or to type that in the chat box. I think we might have one other question coming in. Oh, no. Okay. Looks like that's all. As we're closing, if anybody has any final comments or questions, feel free to type those in. But I'll just say thank you again for joining the webinar today, for your interest in the campaign. As a reminder, we will email you a link to this recording, and we encourage you to share the recording and the presentation materials with anyone or any other organizations who you think may be interested in learning more about this or applying for the workshop. We also hope that you'll take a few moments to fill out a short survey that should pop up when you exit this webinar to help us evaluate and hear your feedback on how this went. And please feel free again to contact me or Amy if you have additional questions. And I'll just pause here to see if Amy or William, if you have any final comments.
I think, no, I think that's pretty much it on my end. But as I said, if anyone has questions, they can, obviously ask me, and I'll be glad to answer.
And likewise, just to thank everyone for attending, and please don't hesitate to reach out if you have any questions at all about the methodology or otherwise about StoryCenter. And we look forward to hearing from people. Thank you so much.
All right. Thank you again, everyone. And we will be sending you some follow-up materials soon. Hope you guys all have a great rest of your day. Thank you.
Thank you.
Thanks, Rhea.
Thanks, everyone. Bye-bye.